There is considerable evidence of racial ethnic patterning of sexually transmitted infection, STI risk in the United States, US. There is also evidence that poorer persons are at increased STI risk. Evidence regarding the interaction of race, ethnicity, and income is limited, particularly nationally at the individual level. We examined the pattern of socioeconomic gradients in STI infection amongst young people in a nationwide U.S. study and determined how these gradients varied by race, ethnicity. We estimated the cumulative diagnosis prevalence of chlamydia, gonorrhea, or trichomoniasis via self-report or laboratory confirmation for young adults ages 18 to 26, Hispanics and non-Hispanic whites, blacks, and others across income quintiles in the AdHealth dataset. We ran regression models to evaluate these relationships, adjusting for individual and school-level covariates. Results: STI diagnosis was independently associated with both racial ethnic identity and with low income, although the racial ethnic disparities were much larger than income-based ones. A negative gradient of STI risk with increasing income was present within all racial ethnic categories, but was stronger for non-whites. Conclusions: both economic and racial ethnic factors should be considered in deciding how to target STI prevention efforts in the U.S. Particular focus may be warranted for poor, racial ethnic minority women. It has long been recognized that STI risk in the U.S. is strongly patterned by race ethnicity, with much the highest rates amongst African Americans, 1 to 5. Black men have higher risk sexual behaviors than white men. However, even within strata of sexual and substance use behavior, there remain large differences in STI rates between race ethnicities, particularly for black individuals. 6. We expect STI risk to be associated with income, since lower income is associated with less access to preventative information and health care, and increased use of sex for economic purposes and as a psychosocial coping mechanism. Past studies of income and STI in the U.S. have found mixed results. Ecological studies have found a positive correlation between STI rates and area-level socioeconomic status, SE10. 2 nationally representative studies have collected individual-level information on STI infection and income. Among adults in the National Health and Nutrition Examination Survey, chlamydia was associated with poverty 11. Among adolescents in the National Longitudinal Study of Adolescent Health, AdHealth, higher household income did not predict bacterial STI risk, while by early adulthood, AdHealth respondents' childhood experiences of low income were only crudely associated with increased STI risk. 12. Race ethnicity is an important predictor of income in U.S. society. If race ethnicity confounds the association between income and STIs, income may be a mediator or moderator of the race ethnicity STI relationship. 13. The former would reflect a pathway from racial ethnic identity through income that acts similarly for all racial ethnic groups. The latter a pathway that acts differentially by race ethnicity. To fully explore how income interacts with race ethnicity with respect to STIs, and in particular how income predicts STI risk within racial ethnic groups, it is necessary to examine race ethnicity and income jointly. Previous analysis has highlighted the interplay of incarceration, social and sexual network segregation, and impoverished circumstances that places some racial ethnic groups, e.g. African Americans, at far higher risk of infection than the rest of the population, 14 to 16. Analysis of within-race ethnicity risk gradients has been less well explored. One study of gonorrhea risk in California by area-level poverty found that although race ethnicity was the strongest predictor of risk, gradients existed within all racial ethnic groups. The gradient was steepest for whites and shallowest for Hispanics. 10. Another study of the relationship between education and STI risk in AdHealth found steeper gradients amongst white women for self-reported diagnosis and steeper gradients amongst black women for laboratory-confirmed STI. Finally, A study of poverty and STI risk in Ad Health found a non-significant trend towards a significant relationship among Black adolescent men, but no clear gradient for whites or Black women. The bottom line is, Black women need to make better decisions on who they let have sex with them. These wayward women are out of control. It's sad.